Hi, good afternoon, good morning to those in the West Coast, and good evening to those who are in Europe. Roberto, I think the music's, oh good. Welcome and hola. On behalf of the Chilean Planners Network, the New York Metro chapter of the American Planning Association, and the APA California Northern Section, we are excited that you have joined us for COVID Conversation. I'm Hing Wong, one of the international directors for the Northern Section of the. Good evening to those who are in Europe. Roberto, I think the music's, oh good. Welcome and hola. On behalf of the Chilean Planners Network, the New York Metro chapter of the American Planning Association, and the APA California Northern Section, we are excited that you have joined us for COVID Conversation. I'm Hing Wong, one of the international directors for the Northern Section of the. Good evening to those who are in Europe.
Whoops.
Roberto, I think the music's, oh good. Welcome on behalf of the Chilean Planners Network, the New York Metro chapter of the American Planning Association, and the APA California Northern Section. We are excited that you have joined us for COVID Conversation. I'm Hing Wong, one of the international directors for the Northern Section of the. Good evening to those who are in Europe.
Whoops.
Roberto, I think the music's, oh good. Welcome on behalf of the Chilean Planners Network, the New York Metro chapter of the American Planning Association, and the APA California Northern Section. We are excited that you have joined us for COVID Conversation. I'm Hing Wong, one of the international directors for the Northern Section of the. Good evening to those who are in.
We have a technical problem that too much feedback on the mics, so need to do something about that.
I think Hing is coming back.
Okay.
For some reason, Hing's version was repeated. I don't know why.
Okay, I'm back. Sorry about that, everyone. Let's do a reboot number 2. So yeah, this is the first time we did that music, and maybe we won't do that music in the next time. So sorry about that. Well, let me say welcome again, hola. On behalf of the Chilean Planners Network, the New York Metro chapter of the American Planning Association, and the APA California Northern Section, we are excited that you have joined us for COVID Conversation. I am Hing Wong, one of the international directors for the Northern Section of the California chapter of the American Planning Association. The main objective of COVID Conversations is to learn about the diverse experiences regarding this global crisis. We are connecting people, primarily planners from various countries and regions, to share knowledge on how the coronavirus affects the urban setting and how we as planners can better create strategies on rebuilding our cities. We presented session 1 last week, and this is session 2. David Silva and Roberto Morris founded Plan Red, also known as the Chilean Planners Network. They initiated 4 individual discussions on coronavirus earlier this year with 4 different countries: Italy, Mexico, the United Kingdom, and Germany. After this welcome and introduction, Roberto will give a summary of last week's webinar. Both Alex Hines and I are international directors for the APA California Northern Section. Over the last 20 years, our APA section has organized 6 international planning tours to Cuba, China, India, Brazil, Eastern Europe, and Southeast Asia. We were in the middle of planning a tour to the Middle East this year, but that has, for obvious reasons, been postponed. We have also been involved in a couple of collaboration projects in Brazil, and we are delighted to be part of this collaboration with Plan Red. Our COVID Conversation Committee includes 2 APA New York Metro Chapter Board and Committee members, Martha Sickles and Matthew Cunningham. The New York Metro Chapter are our co-hosts for this event. At this point, I would like to introduce Maxwell Sokol. Max is the president of the New York Metro chapter of the American Planning Association.
Thank you, Heng. Can you confirm that you're able to hear me?
Yes.
Great. Hello, everybody. Thank you so much for joining. On behalf of the New York Metro chapter, we're thrilled to be partnering with the APA California Northern Section and Plan Red in organizing this second online webinar on COVID conversations. Thank you to our renowned speakers and all of our attendees for participating in today's timely conversation. From the New York Metro chapter leadership team, I just want to offer a special thank you to our Vice President of Committees, Matt Cunningham, and our Housing and Neighborhood Revitalization Committee Chair, Martha Sickles, for serving as our chapter liaisons to this unique collaboration. And I want to thank all of the organizers, but most notably Heng, who has really done a great job of keeping everything organized and on track. At its core, today's session is about sharing experiences and lessons learned across state and international borders. And the New York Metro chapter is a major proponent of partnership. Today's session effectively complements a collaborative webcast series among APA chapters in the Northeast. Recent webcasts focused on COVID recovery and response include legal challenges in a COVID-19 world by the Connecticut chapter, post-COVID-19 planning and zoning from New York Upstate, COVID-19 effects on real estate demand by APA New Jersey. And we at the New York Metro chapter also partner with other organizations such as the New York chapters of the American Society of Landscape Architects and American Institute of Architects in organizing an annual conference. And later this year, one of the session topics will be focused on public health. As Heng alluded to, we have been and continue to be in a state of crisis regarding the COVID-19 pandemic. As recently as last week, Dr. Deborah Birx noted that what we have right now are essentially 3 New Yorks, referring to Texas, Florida, and of note, California. And today's conversation, including the international perspective from our partners in Chile, will be particularly illuminating. On a personal note, I live just a couple of miles away from Elmhurst Hospital in New York, which had the unfortunate moniker of being the epicenter of the epicenter just a few months ago. And so I personally have a lot of stake in what's going on in our world today, and I'm so thrilled to have this opportunity for collaboration. So thank you again to all of the organizers and speakers, and I hope everybody enjoys today's session. Back to you, Heng. Thank you.
Thank you, Max. Today is the second session of a 2-part series. The first session last Thursday included Professor Ronald Schiffman from the Pratt Institute and Anthony Drummond, Director of Land Use for New York City Council Member Margaret S. Chen. The slideshow and video have been posted on www.covidconversational.cl website. For the spelling of that URL, please go to the last page of this program. We are thrilled to have 4 highly regarded individuals speak on enhancing resiliency and sustainability in housing, mobility, public space, and climate change in the midst of a pandemic. Our panelists include Cecil Corbin-Marr, Deputy Director and Director of Policy Initiative at We Act for Environmental Justice, and Moses Gates, Vice President for Housing and Neighborhood Planning at the Regional Plan Association. Also on our panel are Louise Young, Director of Resiliency for the New York City Department of Transportation, and Claudia Gonzalez-Mazzillo, a consultant in Chile. Both today and the first session are recorded, and the videos will be posted in the link on the last page of this presentation. For those who are AICP, which is the American Institute of Certified Planners, you will be happy to know that 1.5 CM credits are offered per webinar. The questions for the panelists are printed in this program. Part of the discussion from this series deals with racial injustice and how we as a community needs to address that issue in conjunction with COVID-19, as well as with resiliency and sustainability. We would like this webinar series to be interactive, so we ask and have allocated time after each panelist. Please feel free to ask your questions or post comments in the chat feature, and we will use some of those questions and comments during the conversation portion of this webinar. Be sure to write your questions and or comments in the chat function of Zoom. and Martha Sickles will select and read those questions and comments to our speakers. You can even start writing and submitting your questions while the speakers are still presenting. We value your participation. And at this time, Roberto will summarize last week's webinar.
Thank you, Hink. Here is some curves that we have been watching in the last 4 months. Is in March, we started asking to professionals in Italy, later Mexico, United Kingdom and Germany, how was the experience there? And it's very interesting to see how in March we were always everybody was trying to understand what was happening and the differences and the similarities among different countries. Now we can see how there are some learnings from the first part, and how in some cases like Europe there are in a lot better position than other countries, but at the same time they are preparing for this new normal, but at the same time waiting for a second wave. And that is something that we can recognize in this situation, how we are almost overlapping different crises. You know, and the common elements of this crisis are there are underlying conditions that we can find in different countries. Even we are a federal country or a unitary country like Chile, or we are quite wealthy or poor, we can recognize that conditions, and that is something very important for planners. And this is a famous cartoon from Mackay when you can see this is still a way to understand our problems and how we can recognize these, especially social conditions they're common in our countries. David Silva was starting giving us an idea what is happening in Chile. We can see in a very strong way how our social outbreak of October is very connected in the way how we had been dealing with the crisis, with the COVID crisis here. In the beginning, the government was trying to control the crisis, selecting some municipalities, some part of the capital, Santiago, with some kind of lockdown, but that was impossible to control, and we were evolving to have a major lockdown of the city, and finally, like everywhere, is a national crisis. But now, in comparing with March, we can see how we had been learning in some way. Now we have a kind of plan, the step-by-step plan, thinking in the way how we will be moving to this new normal that which other countries in Europe are preparing for. But at the same time, we are suffering with the economical impact of the crisis, like other countries. In the case of Italy, Mexico, and UK and Germany, there are a lot of things that we have been learning. I think it was a very good idea to be checking these countries. In the case of Italy, it was a good example of how nobody was really prepared for the situation in March, how fast grew, but at the same time, how some restrictions in the north provoked a lot of movement to the south, and how they were dealing in the different way in the north and the south. And now in the last weeks, they had been with a lot of less restrictions, but they're worried because most of the people is very happy going back to the public spaces because they are, especially in the South, they are very happy with this possibility to be together in the public space. But of course, they don't know for how long they will have this period of happiness. In the case of Mexico, it was very clear how the level of informality was very important in how the government was trying to deal with the crisis, because they have 60% of the economy in the formal area, and they wasn't able to control with restrictions like Chile, and they try to have more to put more focus on education in trying to have real data, but this situation is still something they are not able to control completely because of this informality and the necessity of the population to move. They cannot control the public transportation, but they have been, I think, it's very smart in the way how had been putting focus and education, trying to be transparent with the community. In the case of UK, they had been moving to different states in the beginning. They were really trying to take some distance of the problem. Even they really suffers in the first weeks. They needed to change their policy to put more focus in restrictions and a lot of support to the NHS, the National Health System, which is a very important element for the way how the country has been dealing with the crisis. They have been now in building this new way of this new normal, trying to be prepared for the second stage. I think the role of the Queen in the beginning was very important to give some idea of as a country united in this new crisis. Germany is a very interesting case because Germany is they're very pragmatic. They decided to be very clear with the problem, that they put in a lot of money, but at the same time thinking in that every family should be aware of their responsibilities. I think it's a good mix of individual responsibility, but at the same time government with focus in welfare. They have been now coming back. They have a new app trying to put more information openly. In the case of California, I think it's very interesting. Alex gave us an idea of how they started. They have a very good started at the first. Everything was looking good because the governor took some decisions to control the disease with some restrictions, putting the social isolation as a big issue, using masks, hand washing was something very clear in the way how they wanted to flatten the curve. You know, the same song that everybody had been trying to sing, trying to avoid that hospitals and healthcare system was overwhelmed. But that part in the beginning, and later I will say that New York was learning in the first part from California. This change, because even apparently they did it good in the first part. it wasn't enough because these underlying factors, even is a very rich state, one of the most richest area in the world. They have a lot of poverty and inequalities. Latinos has 3 times more impact in that the white population is. Even they are with these restrictions. People of color, they need to work and they needed to move, and maybe or it's quite possible that is impacting in the way how California is suffering this new stage, this new wave where is completely different to the situation of New York, because New York was learning about the Californian first stage. They suffer in a very strong way, but we can see how New York now is a interesting case of resilience. Later, our guest, Ronald Schiffman, he gave us a very interesting overview of what is happening, not just in the States, and I think it's everywhere, of how poor they suffer the most, and how we can find these similarities between these different countries. This idea of social distancing, he was very strongly supportive of the idea of physical distancing more than social distancing, creating greater social connections. We need to take physical distance, but is the key to try to create these social connections, especially not just for, this is not just for the crisis, it's for the next phases. And now how they had been learning from the California's mistakes, but because they cannot follow the path of UK, because United States and the state, they don't have the national health system like UK, because that is a very different system. But he was advocating the necessity to be aware of the confluence of problems, and how these intersections reinforces the problems for the most vulnerable communities. But at the same time, he was showing us this image of how we have to be also worried about the good parts. How this problem is able to give the opportunity to the nation to be reunited. These sunflowers as a symbol of the good news that we needed to find. And he was also talking about this, how we can learn from the past. And even he was quoting the Chilean Manfred Magnif, thinking about the past, how in the 30s, the United States was creating this New Deal. Beyond the problems of that deal was a kind of blueprint to reimagine the future. And he was talking about how we can take advantage of that example and to really put focus in the creation of this new normal, not as a bad thing, is the new normal as a good thing, the way how we can transform the society. And later, Anthony Drummond is an expert in planning land use. Is also interesting because he is a native is from New York, from California, but not working in New York. Has been adapting New York as his home. He was putting attention in the land use aspect of these contexts, and how we really need to take advantage of the situation to change policies. It's still a working process where everybody, especially officials, they need to figure out how they will create this new normal, and what is the role of the land, what is the role of the land use, what is the role of the planning in this discussion, and should be an active process of planners. And the other thing which is critical is the discussion of the budget, because now is again is how the problems are overlapping. It's impossible to talk about the budget of the city and not connected with the funding of the NYMPD that is asked, and how we are suffering this perfect storm. You know, we had been dealing with problem that at different level, which is something that we also as a Chilean, we can recognize how the situation in US and in New York is something that we can detect in Chile as well. Of course, it's not the same, but we have some common elements. And another big thing is housing, and you know that New York had problem with affordable housing before, but now evictions is a big thing. Even if there are some law that is postponing the evictions, is something that is have to be addressed now, and it's not just money, it's also how we can able to reconfigure the areas, considering the community input. And he also is aware of the how this transformation will be gradual. The one milestone will be next year for the elections, and that will be an important moment for this process. That is, I hope to be. I don't know if our team is. We would like to say something to about that our last week session. No.
Roberto, go ahead and go ahead. Let's go with the panel.
Okay. This is our the core of our meeting today. Is we're talking with Cecil Corbin Mark, Moses Gates, Claudia Gonzalez, and Louis Young. We will have these questions for them. I will read them. We have a first question for all of the panelists, and later we will be putting focus in some questions depends on the interest and knowledge of our expert. The first question for all of you is, how is your section affected by the COVID pandemic, and how is your advocacy and other works influenced by the pandemic? I would like to give the opportunity to Luis to respond, and later Claudia, Moses, and Cecil. Luis.
Thanks, Roberto, and hi everyone. It's nice to meet you. My name is Louise Young, and I'm the Director of Transportation, or Director of Resiliency at the New York City Department of Transportation. Normally, my work focuses on climate resiliency planning, and in resiliency planning, we think about the vulnerability of people, businesses, built a natural environment to different kinds of acute shocks and chronic stresses. And so I think with that vein, I think it's no surprise that the people in New York who are the hardest hit by COVID are the same Black and brown people who live in neighborhoods with legacies of environmental pollution from various fossil fuel emissions. And so in that way, COVID has really kind of highlighted some of those very pre-existing concerns that we already knew. My day-to-day work has changed dramatically, though, as I was detailed to head up the city's work to secure the food supply chain under the direction of the mayorally appointed food czar to oversee a new city feeding program as a response to the crisis. So although food and climate change may seem pretty different, I think that there's a lot to bring from the field of resiliency to some of the food supply work and understanding what it takes to make the entire food supply chain more resilient, how to adapt to different changing conditions, and how to make sure the most in need people who require food access are actually getting options to do that. And so I think a lot of the principles of resiliency planning around understanding risk and vulnerability and understanding, what can be done in a long-term, more systemic way to reduce the impacts of these shocks and stresses has really been a constant from both my climate change work as well as this new food work. So I'll stop there and let others talk about their day-to-day and impacts of COVID.
Thank you, Louise. Claudia?
Hi, everyone. I am Claudia Gonzalez. I am a consultant and also researcher. And in the area of urban planning and other consultancy work, the pandemic has meant the suspension of many field work. For example, in the preparation of land use plans, a big part of the job has to be with doing field work, and we cannot do that at the moment. So many projects have stopped or been delayed, and many changes also in the community participation activities have took place in those studies and projects. These has implied changes in the norms applicable to those projects. Many regulations and many regulatory changes have been required to give the continuity to some initiatives and to, for example, allow people participation in virtual modes that they were not before. So we have been dealing with more bureaucracy than before. Bureaucracy is being slowest, of course, because they are also being impacted. So we have to reinvent the things that we do, the urban plans, for example, and also the things that we try to connect people with those initiatives too. And for other issues I am involved, for me has meant significantly increasing of collaboration with researchers in many parts of the world. And I think that it has been the good part of the pandemic, if we can say that. I participate in very active groups with other professionals in Latin America, for example, La Red de Estudios Sociales, and in other groups, for example, one that is studying disaster capitalism during COVID crisis, which we have a lot of examples here in Chile, but also in many different parts of the world. Initiatives like this one, the COVID conversations, have also been possible during and due to COVID, and even though the technology was existing before. So it is very interesting how it has been forced us to be connected in different ways.
Perfect. Thank you, Claudia. Moses? Moses, can you hear us? You're on mute.
Yeah, you have to allow
It's not a real web seminar until somebody says you're on mute. That's right. Apologies for that. My name is Moses Gates. I work for Regional Plan Association here in the New York region. We do a little bit of everything with cities and planning. We always say RPA stands for Research, Planning, and Advocacy. So we're a little all over the place in terms of our projects and our approach. How this has affected us, I mean, it's interesting. We try to stay timely, and in February and March, when coronavirus really, people knew it was going to be a thing, we were very much like, my goodness, this is new, and all these celebrities are reporting on their test results, and it seemed very much like a wild card. And we started tracking, correlations, and we started to try to do a little bit of research and a lot of other organizations did too. And somewhere around mid-April, maybe, it became clear that this was not a wild card, that this was something that fits into all of our overall work, because this is a crisis that tracks existing inequities. You know, like most health crises, like most climate crises, like most of our crises overall in the United States and to some extent globally. And I think what it's done is it's sharpened our focus on trying to combat those inequities, so that things like COVID or whatever the next health crisis or general crisis is not approached in a kind of wild card way, that we really do see it through this lens. It's become so obvious, and understand that it's that greater lens that'll allow us to adapt and to combat COVID and to have better outcomes for everyone in the region.
Perfect. Thank you, Moses. Cecil?
Thank you, Roberto. So I will avoid the trap this time of saying I'm talking while I'm on mute. You know, this question for me, I've been asked the question a lot of late, and so I will share with you the answer that I generally provide to people. My organization is 32 years old. I'm, as you heard in the introduction, the Deputy Director and Director of Policy at We Act for Environmental Justice. We are based in Harlem. We have an office in Washington, D.C. We're a nationally recognized environmental justice organization, and our mission is to build healthy communities by ensuring that people of color and low-income residents participate meaningfully in the creation of sound and fair environmental health and protection policies and practices. We envision that our community is both informed and engaged, and that we participate fully in decision-making on key issues that impact the health and environmental conditions in our community. We think of our communities as being strong and equal environmental and benefiting from equal environmental protection, and that increased environmental health through community-based participatory research and evidence-based campaigns is the way that we're going to get there. In short, our organization really organizes locally. We send community organizers into the community and engages people who are most impacted by these crises to be engaged in the planning processes that have brought us the legacy environmental pollution and problems that we have been experiencing since the birth of my organization. So if you ask me how has the coronavirus affected my sector, which I would call the environmental justice movement, I would tell you that it hasn't done anything different in terms of the work that we are doing. For 32 years, my organization has been lifting up the disparities in air quality in communities of color, Black, brown, etc. For 32 years, my organization has advocated to change the policies that allow that to be the everyday reality of these communities. For 32 years, my organization has, with the voices of people that we've organized in Harlem and Washington Heights and El Barrio in New York City, in East Harlem, raised our voices to say that the land use planning that goes on in our community, placing our homes next to garbage truck stations or garbage marine transfer stations or diesel bus depots, are things that should not be, because they're exacerbating already fragile health systems in our community and certainly worsening the life expectancy of many of the residents in our communities. For 32 years, we've talked about the fact that our communities are planned on and not planned with. For 32 years, we've talked about the way in which government makes decisions by valuing expertise of people who go to wonderful schools. I've had the privilege of going to some wonderful schools, but I also recognize that there is expertise in the lived experience of someone who's in a community on the ground that is often not brought into our decision-making process, our policy-making process. And so when you ask me the question, Roberto, of how has this changed or affected my sector, I'll say to you that it hasn't really changed the work that we do. We continue to organize the communities that we were organizing. It is more difficult for us now because we can't go door to door to organize people. And so we've had to move that online. And in so doing, we've had to confront the digital divide that also separates these communities from the information that they need in a pandemic, the information that they need to be schooled appropriately in this pandemic. And I will say also to you that it has brought more attention and some more media opportunities to my organization, but it has not fundamentally changed the work. It's made the work that we do more visible to a wider audience. It's taken communities that have been invisible with their health disparities, their economic inequality, their structural housing challenges that stemmed from things like redlining and disinvestment, and made those things more visible. It's made my advocacy work, so the organizing of community residents, to talk to their legislators, to more directly engage in the policymaking at the city council level, or with the mayor's office, or at the state assembly level, state senate level. That's been more challenging because whereas before we were able to take people on buses to Albany or to Washington, D.C., hearings in Albany are far infrequent now. Even they were infrequent before, but even more infrequent now. And the ability to connect with legislators, all of that has moved online. And so really beginning to sort of ramp up and build muscle for us as an organization to make sure that our advocacy work is online and that we can connect our members via phone or via computer has been one of the ways that it's impacted our advocacy work. But in terms of the sum and substance of what we do, we're still doing the same things that we've always been doing, and the need for that work has only increased because of the confluence of the health crises that our community is facing, the extreme heat and climate crises that our communities are facing, and now the COVID crisis. So I'll stop there.
Thank you very much, Cecil. I will go back to the second question. Can you see it? I'm not watching. Okay. The second question, I think, is more to Luis and Cecil, but all of you feel free to respond. Urban dwellers are concerned by correlation of COVID infections with density. Early studies reveal that overcrowding and no residential density is positively correlated with rates of infections. How do these findings impact your sector and plans to make public and institutional spaces, housing, and transportation safer? Luis?
Sure, I can open this one up, but I'm really eager to hear what my other co-panelists also have to say. And also just want to mention, Cecil, I really appreciated your remarks, and I think that that's spot on. These are not new issues. These are things that we've known, and this is just, another case in point of it having to come to this brink before there is real attention to these underlying societal problems that we've always known about. So thank you for saying that. In terms of the question about density and overcrowding and open space, I think that coming from the Department of Transportation, it's really allowed us to reimagine our streets and to provide better open spaces through our surface transportation network. So through DOT's Open Streets program, we have been looking at not only open streets for exercise and walking and biking, but also for cooling. Cecil, you mentioned heat waves. This has been a really brutal heat wave. For those who are in New York, I don't think it's been a day below 90 degrees in, I don't know, like 2 weeks. And so 5 weeks, thank you for correcting me. And with normal ways of cooling centers closed, so usually our cooling centers are public libraries, senior centers, pools, spaces where we're actually fitting a lot of people into small enclosed areas with air conditioning. And that model is no longer applicable when we have a public health pandemic. And so we are trying to partner with our sister agencies at the Department of Environmental Protection to also provide misters and spray fixtures on fire hydrants, and really think about temporary shading structures. In my role of resiliency, I've been trying to advocate for having those investments be made in communities that we know are already facing high vulnerability to heat. Communities where there are not a lot of shade trees, and communities where there are not a lot of park amenities. And those are the places that we need to really be reimagining our open spaces. We've also been allowing our open spaces to be used for economic development. And so, as many of you are also maybe seeing in your cities, restaurants who were closed for months at the start of the pandemic are now able to, in many places, operate for outdoor dining. And so DOT has been allowing for programs for restaurants to actually be in curbside parking spaces and in sidewalk spaces, and streamlining the, I'll be the first to say the process for doing this is normally very bureaucratic. And so I think there are maybe some efficiencies in government bureaucracy that have come out of necessity of acting quickly that I hope will stay. And the last thing I want to say about open space and overcrowding is it's not just an urban issue. In the sector of food supply, a lot of the migrant labor who are the people harvesting our crops rely upon temporary group living situations. And it's in the East Coast, at least, a lot of this labor force comes in Florida and then comes up the East Coast as the harvest season comes and the crops need to be picked. And so August and September is kind of New England's harvest season. And so people are moving up the coast. And same thing in California, I understand, where in the Central Valley, COVID rates are as high as 18% among agricultural workers. And so the issue of sufficient housing and sufficient housing for people who are undocumented or people who are temporary migrant labor is really important. And so California, I know, has been starting a program to support temporary quarantine housing for agricultural labor to safely quarantine, and also increasing testing capacity. And so those are the kinds of solutions that I think we really need to be thinking about, not just for this emergency, but how do we actually provide healthcare access and safe and secure housing for people who are providing food on our planet.
Sorry, thank you very much. Moses?
Yeah. I think the point about bureaucracies and the adaptability of them was very interesting. And I think we've, in New York, have had a lot of successes in that, we've had some frustrations, but we've had a lot of successes. And, as was pointed out earlier, transforming our school system into a food delivery system, virtually overnight, is something that I don't think anybody ever saw coming. But is something that kind of like represents the flexibility of what we can do here. And I think the biggest lesson with this is, these kind of flexible things that we've managed to do in New York, whether that's outdoor dining, whether that's, our food delivery system and giving meals, whatever that happens to be, we're seeing a lot of, well, when everything's over, life will go, let's just get back to normal. And maybe we should keep some of the things that we've done that have really responded to this crisis and help folk and really helped also, combat some both bad urban design and real inequities. So that's the kind of conversation I'd like to see, started a little bit when we're talking about recovery. it's New York. We get frustrated. We complain a lot. There's a lot of, why can't we do this? Why can't we do that? And I do it as much as everybody. But I also think that the flip side of that is really starting to explore some of these successes and how we can make sure they're institutionalized. Because there is, if we don't push for that, I feel like the inertia will take us backwards on many of them.
Thank you, Moses. I will jump to the third question. COVID is positively correlated with pollution that is more prevalent in low and moderate income communities that require increased funding for community projects and access to jobs brought by climate change mitigation adaptation. Could you discuss your strategies efforts in these areas? I think we could start with Cecil.
So yes, thank you again, Roberto. It is true that all cities and towns across the country are wrestling with devastating impacts of the coronavirus pandemic, but none have been hit harder than communities of color and low-income communities. So when you look at places like Detroit, a city that has a very high African-American population, Chicago similarly, St. James Parish in Louisiana, or New Orleans in Louisiana, or East Harlem, El Barrio here in New York City where I'm from, and the South Bronx also here in New York City where I'm from. Those communities have been plagued by decades of economic inequality, but they've also been plagued by pollution at extraordinarily high rates. They've experienced some of the highest mortality rates for the virus. There have been recent studies that have shown the link between high levels of pollution and an increased risk of death from COVID-19. And as I said earlier, these issues in terms of the rates of respiratory illnesses in our communities are not new to us, right? I think that we are fortunate in many ways that, the two other types of coronavirus that we are familiar with did not sort of come to the U.S. shores in the way that they had before, because we would have been dealing with some of the crises that we're dealing with even earlier. The thing that we continue to do in terms of our strategies is to try to tackle the structural racism. So, and the effect that structural racism has had on either the people living in our communities or the physical infrastructure in the communities itself. And so, for example, what do I mean very directly by that? We have, in the wake of the COVID crisis, really been doubling down on our efforts to make sure that the infrastructure for cooling in the city of New York is expanded in ways that are both safe during the COVID-19 crisis, but also look at the long-term structural issues within housing in our communities that have left us in this particular position, right? So the disinvestment, when we talk about structural racist issues that have impacted housing in New York City, we're talking about the practice of redlining, the practice of chronic disinvestment or underinvestment in houses where you may not yield the market rate rents of a Park Avenue or the Upper East Side in some instances, right? Really trying to tackle what that disinvestment has done. It has made our homes very energy inefficient. It's caused the residents in those homes to have exceedingly high energy burden and energy insecurity, meaning that they are often making choices between, well, do I run an air conditioner, which is no longer a luxury, as we've just had, 4 or 5 days in a row of 90+ degree temperatures. And, the year before, July of 2019 was the hottest year on record. And then prior to that, July of 2018 was the hottest month in the hottest year on record. I mean, an air conditioner in a place like New York City with its urban heat island effect is not a luxury, right? And it's really one of the sort of the tip of the spear of the public health crisis that the climate crisis is fueling. And it's particularly impacting African American communities because those are the communities that are having the highest rates of heat-related morbidity and, sadly, heat-related mortality issues, even right now as we talk about the climate crisis. So we are doubling down on saying the structures of our government need to be able to provide resources for running and operating an air conditioner. That affordable housing needs to be built in such a way that it is energy efficient so that we're not putting people into affordable housing and creating a subsidy for affordable housing only to come on the back end and have to subsidize even further the ability for people to stay in those homes without the debt of a utility hanging over their heads, right? Because they wanted to run or needed to run, not even wanted, but needed to run an air conditioner. So we're doubling down on things like saying the city really has to think more creatively about the programming of cooling centers. They have to make sure that people understand if they don't have an air conditioner in their homes, where do they access a cooling center? I've seen two news reports where they're telling people, well, if you want to know where your cooling center is, you know, go online to this particular program, to this particular website to find out that information. In a city where we still have a significant divide, digital divide, that is not an effective way of communicating information to people for something that is not a luxury, but an absolute necessity to help them stay alive and stay well, right? So we continue to advocate for those types of things. Beyond sort of the temporary fix of like getting resources to pay your bill or getting the city, for example, to install 74,000 air conditioners. We've talked about also going to the state, not talked about, but we've supported the city's petition to the Public Service Commission to get reductions on the utility bills for the lowest income people in the city. That will impact over 400,000 families in the city. And we were proud to support the city in that petition. It was the right thing to do, and we were pleased to support them on that. But we also look at the more long-term structural fixes, right? How do we make sure that affordable housing in this city is safe housing? It's safe in extreme heat. It's safe so that when you have a pandemic and you ask people to shelter in place, that things inside of the home are not triggering asthma. So the homes aren't too hot, which can trigger asthma. The homes have AC, which can help reduce that. But also things like removal of gas stoves, which throw off lots of pollutants that have already been shown, for example, to cause and trigger a higher level of respiratory attacks in younger children. So we continue our advocacy for those kinds of long-term structural fixes that get at the root of some of the systemically racist challenges that have left us in the place of racist policies, that have left us in the place of having affordable housing, but that affordable housing is creating extreme health burdens on our communities. And I'll stop there.
Thank you, Cecil. Luis, do you want to add something?
Yeah, just what Cecil was saying. I think it's important to also think about the more global impact of air conditioning in general. We're very used to, many of us go to a place during the workday with central AC. And now that everybody is relying upon AC window units, this is creating a lot of electrical demand for the grid. And that means that the utility has to turn on what we call peaker plants. Plants that are usually on standby for reserve and are typically a lot more polluting. And so when we have a lot of electrical demand, these peaker plants need to be fired up. And those are often very correlated to low income areas of color. And so I think there is a very strong impact, not only on the heat vulnerability side, which Cecil gave such a great overview of, but also on the climate emissions side, that we just don't have good strategies here. And this is a really significant problem.
Thank you. We will jump to the third question. Sorry, to the fourth question. The societal shutdown had drastically affected the global economy with huge impacts on different sectors and types of businesses, especially small businesses. Please discuss the impacts and strategies for recovery. We could start with Claudia.
Okay, thank you, Roberto. For small businesses, it has been really terrible, I think. In many cases, they, or may I say we, were affected first by the effects of the social outbreak occurred in October in Chile, and then by the pandemic in 2020. For a lot of businesses, the debt is very, very high, and there is hope, and the hope is pinned on a recovery that it is still uncertain because we don't know how long it will take. But on the other hand, we have found a lot of interesting and very good examples of reinvention and mutual collaboration between businesses, between civil society organizations. And we have acknowledged the importance of those kind of organizations in bringing together, for example, the people in need with the people who can donate or who can collaborate. And we have found that it is very important how people and society can make the difference too, regardless the attitude of a state or the authorities. I want to point that.
Thank you, Claudia. Moses?
I mean, in terms of business and workforce and low moderate income communities, you know, it's endemic of the same thing, which is some people have options and some people don't. You know, and that's only been exacerbated by COVID. You know, you have if you know, you have money, you have options in terms of childcare. You're much more likely to work at a job where you don't need to be physically present. You're much more likely to have a healthy living environment. And these are all things that, you know, in normal times affect folks, and in this time affect people even more and affect health and well-being even more. And I don't, you know, I don't have much more to say about it than that. It's a problem of inequality, and it's a problem of our society. And, you know, I think the solutions are well known. You know, I don't think that, you know, there's a special little idea somebody has thought of that's going to, you know, solve this. It's, you know, give people money to stay home. That's what the deal is. Put in place childcare. You know, make sure that you know, if you that people have the option of you know, being able to take care of their kids and provide for their families and not get sick. I mean, it's not rocket science. And, you know, other places throughout the world have, I don't want to say done it, but made a lot more progress towards that. You know, and that's all. It's a question of politics and political will.
Thank you, Moses. Luis, I think you have your ideas about this.
Yeah, I wanted to talk a little bit about food businesses, particularly because they're such a unique segment of small business. For some scale, almost all of the food businesses based in New York are considered small businesses. And kind of building off of what Moses was saying, it's the same thing on a business level as it was to what you described on the individual level, where access to working capital is really what has been dictating who is thriving and able to adapt and who really cannot. For those of you who may not know, the federal government did issue some small business loans through what was called the PPP program, but it did not go to many small businesses. It went to a lot of big box chain stores. And what we saw in New York, and I think this was echoed in many places across the rest of the United States, is that actual local businesses had no access to federal help. And that is a really big problem because even though food businesses were classified as essential and many of them continue to work, profit margins are notoriously thin for food businesses. Grocery stores make 1 to 3 cents on the dollar. And so when you think about how little that is to work with, when you have to install sneeze guards and buy PPE for employees, all of which are good. We should be allowing for those things, but it costs money and it costs operating money that is continuous. So I think other challenges that we've seen kind of thinking about the role of adaptation of these businesses who can adapt and who were not closed. Many businesses adapted new lines of operating. So online grocery delivery doubled compared to 2019. Restaurants who were forced to close indoor dining now sell grocery items. Many of them have also done donations, as Claudia was saying, and made a lot of operational changes to their stores. But I think that this also goes to the systems that have a harder time adapting to these new needs. For instance, SNAP, which is the food stamp program, which is governed by the federal regulations, is only available online in some states through Walmart or Amazon. Those are the only online delivery options for SNAP, for food stamps. This means that if you are immunocompromised or if you are otherwise homebound, if you're a senior perhaps, and you don't feel safe going to the grocery store or cannot make it there, there's really limited options for you to utilize your food stamp benefits. And not to mention the digital divide that Cecil already mentioned. So I think that in thinking about what economic recovery and a just economic recovery looks like, we really have to think about who we are serving and what is the role of the private sector and how can we incentivize better serving our vulnerable communities who need access to food and other services. And what is the role of the public sector in really pushing for those incentives, making sure that the city's programs are responsive to the needs that the private sector is otherwise not providing. So I think, yeah, we'll stop there.
Thank you, Louise. Cecil, do you want to add something?
Roberto, were you asking if I wanted to add something?
Yeah, I think yes.
Oh.
I think the next question is you can start also, but I would like to also ask you if you want to say something about this.
I was literally just nodding in support of what Louise was talking about. I think the centering of people on the front lines of some of the health inequities that we're facing and the climate crisis, as well as this pandemic, is really, really important. And I would just also just say that, you know, for a long time, the issue of race has been something that has paralyzed the conversation in the United States. And I've been fortunate enough to also have experiences in other countries around the world. And I know that this issue is one that is not completely unique to the United States, although there's a special brand of it in terms of the United States and its historical context here. But there is statistical evidence that documents the issues of air pollution, the issues of environmental dumping, the placement of communities of color in the harm of toxicity, and on and on and on. These things are not coincidence, and that in the United States in particular, the thing that is most statistically repeatable and prevalent about your ability to be in a place that is both harmed by the worst air pollution and intoxics is borne out by a battery of studies that race is the most statistical thing that sort of allows you to end up in these circumstances, and then economics, right? So it is important for us to recognize that there are lots of low-income white communities in this country that are experiencing incredible burdens and challenges, but it is race as a predictor that is most reliable in determining your situation in terms of air pollution and toxics and so forth. in this country. And we really do need to continue to center that conversation and continue to create systems where we are actually confronting it head on and not sort of continuing to shove it down or push it away in terms of how we think about policy. Declaring things like racism as a public health challenge is a critical must if we are to really move forward there.
Thank you, Cecil. And now this is the final question, and we have several questions from the audience as well. Have you identified any key lessons learned from COVID crisis that can inform how we develop greater resilience moving forward, particularly as we cope the large scale problems such as climate change? Claudia?
Yes, thank you. In fact, I am still a bit skeptical, about how we learn and if we learn the lessons that we must, because we see that the outbreaks, that the new waves of COVID infection that we have already seen in Europe after the end of the quarantine and the lockdowns, make me think that the same thing will happen here in Chile and everywhere. However, I still believe that the pandemic has highlighted how important the pre-existing vulnerabilities and inequalities that have already been mentioned here, which is the role that they play regarding the effects of a slow disaster like this one, like the COVID, and also like the climate crisis. And in fact, there are these long term effects are very visible now. So we have to think how we will move after the pandemic and during the pandemic to deal in a better way with other kind of hazards like the climate change or anyone. And another issue that has been highlighted is the importance of preparedness and resilience to better cope with any kind of hazards like this one, like the like COVID, like an earthquake, like climate change, whatever. And these are continuous processes that must be permanently monitored and require economic resources, require technical expertise, and require political will, and all of which are necessary and all of which we are responsible to ask for them and to provide them. Mm-hmm.
Thank you, Claudia. Moses?
I'm glad Luis brought up the PPP program, which I think holds a really important lesson for climate change and all the other things. I mean, PPP could not have been a worse designed program. And what it did is it put relief through our current structures, and our current structures are designed to funnel money to the wealthy. You had two criteria for getting PPP. You needed an existing relationship with a large bank, and you need to be able to get the paperwork in on time. And both of those things gear very much towards large institutional businesses and nonprofits who are able to do that. And you probably need the short-term help comparatively less than smaller organizations. I can easily see a climate event happening, and if you put in place the same type of process without taking into account kind of a lens of inequity or previous injustice lens, what's going to happen? The rich areas are going to be the ones who get recovery, resiliency funding and are able to do things, and poorer areas and communities and people are left in the lurch again. So I think that the biggest lesson that you can learn for the climate emergency is, again, it's one of a deliberate addressing of equity when we formulate our programs. And, you know, as Cecil had said earlier, kind of taking a little bit more expertise and lessons from communities who are most impacted, maybe to design these types of programs so that they're not left out in the future, like folks were under PPP. And I do, you know, PPP is a federal program. Our federal government is, you know, considerably worse than our state and local governments, you know, here, I'll say. But I also think there's lessons to be learned in the state and local government as well.
Thank you. Louise?
In terms of lessons learned, this has been, I feel like, the theme that I've been trying to hit on, but just that, yeah, planning has to be centered around our most vulnerable communities and people. And as planners, it is our obligation to find solutions that address these underlying issues, which are not new. Solutions like access to healthcare, access to food, access to safe, affordable shelter, access to a healthy environment. This is the stuff that will increase, you know, resiliency to COVID, resiliency to climate change and other kinds of emergencies. And it will help, you know, our communities be able to. I saw a question from John in the chat about specific lessons of emergency work, bringing back to DOT. And I think to be more concrete about that and what I'm taking from this is also thinking about what makes businesses more resilient. That has not been historically a focus of my personal climate change practice, but this opportunity has given me a lot of time to actually talk and engage with grocery stakeholders and food wholesaler distributor stakeholders. And so what we've also done as part of our emergency work as the crisis became a little less acute was engage them in scenario planning about different risks and different kinds of emergencies that they may face so that we could better understand how to support them, not just for this right now moment, but in the longer term. And so climate change came up a lot, actually. And I think a lot of the standard toolkit of solutions that we imagine for businesses, like, oh, just get backup generation, doesn't work for a lot of food stakeholders for various operational reasons. Primarily, they're often renters and they can't make a lot of capital upgrades to their buildings. And so I think that the things that I'm trying to take from this is really more about the systems level issues that really feel the most pertinent across multiple kinds of emergencies, and then thinking more about how those systems level issues relate to actual businesses, actual people, actual neighborhoods, and then try to find tailored solutions that actually work for the needs that these different kinds of groups have. And food is such a unique space compared to other food or other small businesses that I feel like I'm still learning a lot about emergency planning for the food sector as a whole. Also because food is emotional. Food is not just caloric intake and getting a ready-made meal. It's cultural, it's religious, it's emotional, and it also helps us navigate difficult times. And so I think the interesting dynamic of food compared to other kinds of emergency operations is that kind of really personal, the need and the utility of food, but that personal connection to food that should not be overlooked as something that's like a luxury. I think it is really critical to how people are able to weather emergencies.
Thank you, Louise. Cecil?
And thank you, Roberto, and thank you to all of the other colleagues on the panel. I would think that a key lesson that I've learned in this process is that whereas I used to think of the work of the digital divide as something that was peripheral to my work, peripheral is probably not the right word specifically. I've come to realize that I have to, engage with WEACT members, and we have to be fighting for the closing of that divide too. So that's one lesson that I've learned that I think is really pointing me to something that is another sort of bucket of work that has to be taken on to make sure that as we continue to fight the climate crisis, that our communities have real access to the internet to be able to deal with some of the issues that we have traditionally been talking about. You know, the rise of telemedicine, for example, and the recognition that, you know, we could have other pandemics that cause us to think about the home as a place for sheltering as our most critical public health tool for dealing with those pandemics, has also really made me focus and double down on the issues of what it means to create healthy homes, safe homes for people. Our work has traditionally been focused on removing lead and mold from homes. We've done that work for a long period of time. But in a pandemic like this, it really makes us realize that that work is further critical, because when you think about the home as the place for us to sort of, sorry, not as the place, but as the tool that is most critical for us to deal with getting our hands around this pandemic, that really makes me focus and understand that making sure that homes are energy efficient, making sure that homes are places that are free of lead, free of mold, is also critical for dealing with a pandemic that, at least at the outset, is one that's attacking the respiratory system, and is one of other pandemics that we've seen, even though all of them have not sort of impacted the U.S. Other lessons that I have learned is that Zoom has to become something that we can really effectively reach out to people in our communities. And so we have explored the issue of how do we do translation. A large cross-section of our community, our base, the base that we organize, speaks Spanish. And so we've had to figure out, how do we do that on Zoom? We've gone from having, 100 people at our in-person monthly membership meetings to having 150 people on the Zoom platforms for our membership meetings. But I'm critically concerned that what happens in terms of language access for a lot of my brothers and sisters who their first language is not English, right? How do I make sure that those things are happening? And how do we create platforms that allow us to continue to raise our voices to the people whose salary we pay, especially, when you think about, people occupying public housing like 1600 Pennsylvania Avenue, who are allowing this pandemic to absolutely run away and do nothing with the vast set of resources that we have federally, and is just really fueling the death of many people in our communities. We need to be able to raise our voices directly to those kinds of folks, but we can't do that unless we are clear about how to use the technology that we have in a way that allows for our advocacy to really reflect what we would have done in other times, which is, march to a place or hold a rally outside of a place. Things that are sadly necessary, but are also fueling the public health crisis. We've got to figure how to move those things even more effectively onto a digital divide. And so those are lessons that I'm taking away from the work that I do, both in the policy arena, but also in the organizing arena as well.
Well, at this time, thank you, Cecil, and thank you for all of our panelists, Moses, Cecil, Luis, and Claudia. We're going to extend this webinar by about 10-15 more minutes so we could get some questions in. And if Martha is ready, why don't you start off with some of the questions that have been posted on the chat?
Certainly. I just wanted to read one comment that came in from Louise Fisher, who basically said, or Lois Fisher, COVID is a dry run for climate change. And I think we've been talking about that. Juan Borelli has asking the question of Cecil, and I think you answered a little bit of this, but how are you building leadership capacity, or what tools are you now using in the community under the pandemic's new normal so that the community does not continue to be planned on versus planned with?
I finally did it. I started talking without unmuting. Thank you for that question. Very quickly, I think that what we have done is continue to try to create a community where people can continue to come together to share how they are impacted by the COVID-19 crisis, but also to strategize with them about how we move forward with our advocacy in this moment. That is our monthly membership meetings, which have moved from being in person to being online. We also cultivate leadership in our community members by actually having trainings, which have also moved online. We run something known as our Environmental Health and Justice Leadership Training, which is about a 20-module training process where we go through a variety of different environmental and environmental health issues, but we also train people on how to publicly speak and testify about their complaints and concerns, how to understand the political system, and how to organize in their communities. So those are some of the things that we continue to do. Thank you.
Thank you, Cecil. There's another question for you from Lois Fisher, and she'd like you to give an example of how your advocacy changed the outcome of a planning process.
So the best example of that, and I'm grateful to the American Planning Association, the New York City chapters. I worked with Mitchell Silver, who is the current City Parks Commissioner, but a longtime planner here in the city, to organize a community process called Harlem on the River. And through the Harlem on the River process, we engaged community residents in the West Harlem section of Northern Manhattan in a community visioning process that did transform what the city had planned for that 125th Street Hudson River. For those of you who know New York City, to locate you there, that particular area of the waterfront. If you go there now, you will see a public park called West Harlem Piers Park. And that park was the direct outcome of our community visioning process and our advocacy to prevent the city from putting up a hotel and thereby shutting off the access to the waterfront to local residents. If you go there today, you'll see a vibrant park that was really the result of our community visioning process, and then our engaging residents and advocating with the mayor and the state government to get resources to actually build that park, which transformed the direction that the city had proposed to go in, which was about building a hotel.
Thank you very much. Next question for Claudia is your prognosis for the economic recovery in Chile and some policy recommendations to move that along.
Oh, thank you for the question. I am not very optimistic, really. I think it will be very slow, but there are some contradictions that we can observe in Chile every time. For example, the withdrawal of the 10% of the funds for pensions that has been approved recently here to allow people to take part of the savings for the future pensions to deal with the pandemic now. In the first time, they caused a shock in the stocks of the national enterprises. But after it was approved, there was an increase in the stock value because it's a lot of people think that the injection of that money will allow that a lot of people can consume more that have done during the pandemic, so it will help to reactivate the economy. Regarding recommendation of policies, I think that we should have to consider more. For example, local governments, I think they have been very, very important during the pandemics, very, very important on how and for whom should be benefits or whom requires more help. I think we have to provide resources for local governments in normal times and not only during emergencies. And this is very important for the how we localize economic recovery. And also I think it will be necessary and it's be more important than ever that we can change our present constitution and the ongoing process to have a votation about that in October is very, very necessary in that moment, because we have realized that part of the problem is the political and economic model that we have.
Thank you. There was a question from John Chow to Louise, and I think that you answered most of it, which is the lessons learned from your emergency work in food and how you brought that to your long-term role for resiliency in New York DOT.
Have anything to add other than the food work is still ongoing and that food insecurity is still at an all-time high. So it's not quite over yet. And so I imagine I'll continue to be learning lessons as this continues.
Okay. So this is a question for probably Moses and Louise, but what is your assessment of the future of working remotely and the impact on the real estate and public transportation sectors in the region?
Oh man, I'll take it. I'll take a shot at it. I think the answer is nobody really knows, because you know, once the ability to not work remotely is back in place, you know, I don't think there's a, you know, I don't think people have a total understanding of, you know, if that's going to be a popular thing or not. I will say that, you know, I hear a lot that the lack of demand in Midtown for office space because of COVID and working remotely might be offset by people wanting more space per person in those offices, you know, for social distancing and things like that. And that's kind of the, you know, the take of a lot of the real estate, the optimistic take of a lot of the real estate community. It's not necessarily mine, but that's kind of what's going around a little bit. You know, I will say that Manhattan will be interesting. You know, I have, even though it's super hot out, you know, biked all over town and tried to just, you know, visit as many different neighborhoods and places as I could. And, you know, I would say in most, you know, residential or mixed use neighborhoods, I don't want to say life is back to normal or it's easy. I mean, people are definitely hurting and feeling the impacts, but there's street life, you know, and things are, you know, more open than they were in April, and things are happening. If you go to like Midtown, you know, it's not the same place. It's you know, you can tell that it is supporting a tenth of the population that it usually does. And it'll be interesting to see if that, you know, what that trajectory is and if it will return to something like before.
Would others like to comment on that question?
Sure, I can comment a little bit. I mean, I think one question that I don't think we have answers to right now is just what will at least for New York, what will the population impact be? So many people in Manhattan has decreased in population by about 20-25%. Outer boroughs population has remained the same or you know, roughly the same. And this is based on not census data, of course, but DSNY's collection of trash and looking at trash volume output per capita and how that's changed week to week through the pandemic. So I think that's one larger question that I have of how this will all play out and whether that can create more opportunities for affordable real estate that is so desperately needed in New York City. On the transit front, Definitely subway ridership has just plummeted, but biking is at an all-time high. And so I think that there's also some interesting opportunities there in terms of better infrastructure to support cycling. And then the third thing that I wanted to share is, like, I don't know how many of you all in the audience work for city government. I have for many years, and it has sort of forced city government to come into the 21st century in regards to technology. We did not really have great technological options to work from home for many people. I think this has been actually helpful in creating more flexibility and more adaptability in a way that, you know, I hope that these investments will persist for city government to serve the people, the residents here. So yeah, those are some thoughts that I have about changes in these markets.
Well, thank you to our panelists again. Right now, we'll have Roberto give a quick summary and close out the program.
Yes, thank you, Hing, and thank you all of participants. Very interesting. I think I will just mention some few ideas. I think we should write an article about this, because we have a good summary actually of the different things we have been discussing. I think this webinar is a good example of how we can create a learning platform in a very easy way. I think it's interesting, several connections among what is happening in the state and what is happening around the world, but especially in Chile. I think is we said several times that this is our previous conditions that we are facing now, and how Cecil said we are doing almost the same, and we are dealing with the same problems. But the good thing that crisis visualize problems, and now we can see them in the first row. I think that is, we should take advantage of that. Like in the state is a systematic racism is very strong. In Chile, we can recognize that is similar to the systematic classism. Is quite a similar behavior, but a different from different perspective. And also our necessity to adapt, and how we can think in this flexible city or the new words that we will find in the future, like the 15-minute city is, I think it is very important, the role of social infrastructure, all the examples that you gave about the cooling centers, how air conditioning is not a luxury. I think that is another thing, is what is a luxury? What is the right for individuals or communities, different neighborhoods, how we will be redesigning cities, thinking in the rights. That is something we need in every house, or in every building, or in every district. I think we really need to find a way to take advantage of this crisis to redefine what is a right or what is a luxury. And also is how these help is also showing inequality. The PPP is a good example of also some programs here in Chile, how money is going to the big sector banks, and how we can find a way to really help who it's needed. I think it's an open question, but we have to be aware. I think it's good to say it, at the same time to find some important things. How food, I love when Luis said that food is emotional. It's because we can talk a lot about our problems just thinking in food. Revolutions has started because of lack of food, and now we need to think in this new revolution in the good way. I could continue talking. It was amazing. I'm just would like to say thank you to everybody, especially to our speakers. And also, I'm very proud to have this group of friends. The team, we have been preparing these activities with California first, and now to New York, I hope, with other places in in New York and everywhere. I think we really, I really believe that we can have this international platform. And of course, for our Chilean friends, the language is a gap. I hope we can find a way to have a proper interaction at multi-language levels. Thank you, everybody. We will be in touch for the next activities.
Yes, thank you, everyone. And if you like to see the video or share it with other people as well as the program, go to the last page of this program and you'll be able to link to the slideshow as well as the video. Thank you, everyone, and have a good day. Take care of yourselves. Stay safe.
Thank you, everyone.
Bye-bye.
Bye.
Bye-bye, guys.
Ciao.
Sorry about my mistakes in the chat.
Thank you. Bye.
So we can, bye.
Bye-bye.